Good morning, children. I'm Dr. Hema Harris. Today we shall continue with the tympanic part and the styloid process of the temporal bone. First, let's see the tympanic part. The tympanic part is the curved plate of bone. So this is the tympanic part. Okay, this is the tympanic part, which is marked in a brown shade. This is the tympanic part, which is a curved plate of bone. It is situated below the squamous part. We know that this smooth area is the squamous part, and in front of the mastoid part. This is the mastoid part. So the tympanic part is located below the squamous part and in front of the mastoid part. Now, it joins the squamous part at the squamo-tympanic fissure. So, there is this part where it joins the squamous part is called the squamo-tympanic fissure, and where it joins the mastoid part is called the tympanomastoid fissure. So, there is a nerve called the auricular branch of vagus which emerges through the tympanomastoid fissure. So here again we was talking about the tympanosquamous and the tympanomastoid fissures and the auricular branch of vagus emerging through these fissures. Tympanic part has two surfaces, anterior and posterior, and three borders, lateral, upper and lower. Here we can see the anterior surface of the tympanic part. This is the tympanic part. This is the anterior surface. Now we know that there is a fossa here in front. They're called the mandibular fossa. We had learned about the mandibular fossa when we were doing about the squamous portion. Now, mandibular fossa, we had said that the anterior part of the mandibular fossa is articular, forming the temporomandibular joint, and the posterior part is non-articular. So the anterior surface of the tympanic part forms the posterior non-articular part of the mandibular fossa, and this part is related to the parotid gland. Whereas the posterior surface forms part of the posterior wall of the external acoustic meatus. See this opening outside? This is the external acoustic meatus, and the posterior surface of the tympanic part forms certain parts of the posterior wall of the external acoustic meatus. The medial end of the posterior surface has a sulcus called the tympanic sulcus. That is the medial end of the posterior surface of the tympanic part has a sulcus called the tympanic sulcus. And what is attached there? To the circumference, the tympanic membrane is attached to the circumference of the sulcus. So coming to the borders, we have the lateral border, upper border and lower border. Lateral border is free and it joins with the cartilaginous part of the external acoustic meatus. Upper border, it is divided into the lateral part and medial part. Laterally fuses with the postglenoid tubercle and medially it forms the petrotympanic fissure. Lower border, laterally it splits to enclose the root of the styloid process and medially it will extend up to the carotid canal. This is the postglenoid tubercle where the lateral part of the upper border fuses with the postglenoid tubercle. In this slide, we can see the petrotympanic fissure. So this is the tympanic plate. It has a upper border. Laterally it will articulate with the postglenoid tubercle and medially it will form the petrotympanic fissure inside. Next we can see the process of the temporal bone. This is the styloid process. Styloid process is a slender pointed part of the temporal bone. It projects anterior-inferiorly from the inferior surface of the bone. The styloid process can be divided into two parts, a proximal part which is also called the tympanohyal part and a distal part which is also called the stylohyal part. The proximal part is surrounded by the bony sheath which is derived from the temporal bone, that is from the tympanic part of the temporal bone. And the distal part or the stylohyle part is the lower part which we can see, and all the further descriptions are related to the stylohyle part. Several important muscles and ligaments are attached to the styloid process. The three muscles are styloglossus, stylohyoid, and stylopharyngeus muscles, and two ligaments, stylohyoid ligament and stylomandibular ligament. These are the structures which are attached to the styloid process, and these muscles and ligaments are in close association with the tongue and the larynx. The stylomandibular ligament, you can see here, this is the stylomandibular ligament. It is a cord-like condensation of the deep cervical fascia, and it extends from the apex of the styloid process to the angle of the mandible. So this stylomandibular ligament separates the parotid gland above from the submandibular gland below. Important relations of the styloid process. Styloid process lies between the parotid gland laterally and the internal jugular vein medially. The external carotid artery crosses the tip of the styloid process laterally. Facial nerve crosses the base of the styloid process laterally. So, external carotid artery crosses the tip, whereas the facial nerve crosses the base of the styloid process. And on the medial side, the internal jugular vein and the last four cranial nerves are related. So, medial to the styloid process, we have the internal jugular vein and the last four cranial nerves, that is 9, 10, 11, and 12 cranial nerves. There is a foramen that is related to the styloid process called the stylomastoid foramen. This is the stylomastoid foramen. This is the styloid process here, and this is the mastoid process. So this foramen lies between the styloid process and the mastoid process. That is the stylomastoid foramen, and it transmits the facial nerve and the stylomastoid branch of posterior auricular artery. Now, the ossification of temporal bone. This is important because temporal bone ossifies partly in cartilage and partly in membrane. We have heard about both membranous ossification and cartilaginous ossification. Cartilaginous ossification is also called endochondral ossification. So, which are the parts which are undergo membranous ossification? The squamous and the tympanic part undergo membranous ossification, and the petromastoid part and styloid process undergoes this, cartilaginous ossification. The tympanic part is the curved plate of bone. So this is the tympanic part. Okay, this is the tympanic part which is marked in a brown shade. This is the tympanic part, which is a curved plate of bone. It is situated below the squamous part. We know that this smooth area is the squamous part, and in front of the mastoid part. This is the mastoid part. So the tympanic part is located below the squamous part and in front of the mastoid part. Now, it joins the squamous part at the squamotympanic fissure. So, there is this part where it joins the squamous part is called the squamotympanic fissure. So, with that, we have completed the temporal bone. We have finished all the 5 parts. We have done the tympanic part, the squamous part, the petrous, mastoid parts, and the styloid process. We have also covered the ossification. Now there is a little more left which will be taken in the next following PPT. That is about the spaces and the canals present in the temporal bone. So make sure you go through that PPT also, because we'll be discussing the applied anatomy along with the spaces and the canals in the temporal bone. Thank you.